Hi everybody, I want to welcome you back to the ESOL Beginners class for Blue Ridge Literacy. I'm going to be working out of this book today. If you have this book with you, you can keep up. This is Step Forward 2, and we're going to be working on Unit 8. I'm on page 102. If you have your book, get your book and follow along. Today we want to talk about your health. If you're healthy, feel good. And if you don't feel good, what we can do about it. You can have a temperature. You feel hot, feel very hot, very hot. Your temperature should be 36.5 to 37.5 Celsius, or 97.5 to 99 Fahrenheit. That's your temperature. Some people take your temperature with a thermometer in your mouth. We want to keep your temperature normal. If your temperature goes up, you can do several things. One thing is there are pills you can take. This is ibuprofen. Ibuprofen or Tylenol. They're little pills. This is our bottle. We have to push down and twist to open. You got to push down and twist. Right? Then there's a seal. You want to make sure there's a seal. This is good. Keeps you safe. We're just going to pop that open. See these little pills? You want to read the instructions. It's usually every 4 hours if you have a temperature. Every 4 hours. Ibuprofen or Tylenol. Ibuprofen. This can help very much with the temperature. Also, if you cut yourself, if we get a cut, after you've washed it very good, you want to wash. We have antibiotic ointment. And this is just a greasy, you can see it's kind of a oily substance, and you want to put that wherever you have your cut. This keeps it clean and keeps out nasty things, the things that can hurt you, an infection, right? Just easy, doesn't smell. Any cut, anytime you have a cut, you want to use this. All right? This is cough medicine. Cough medicine. And it has a little cup. You can pour this in a little cup and drink. Cough medicine. Now this one's hard. Guaifenesin. What you want to look for are the words cough. See where it says cough and congestion? That's what we want to look for. And this will this will wipe out your cough. Helps very much. There are also pills you can take. These are pills, cold and flu. COLDFLU. If you cough or you vomit, these can help. Take these, you have to see how they bend and rip, then you peel up the corner and take the pills. You can sometimes push them out. What I do is we're just going to cut right up the middle, and you take these if you feel bad, especially your nose, if you have a headache, or if you cough. Our ibuprofen we did earlier also works on headache, a headache, right? So let's talk about these words. If your head hurts, we call that, this is your head, we call that headache. Oh, when your head hurts. Oh, it's bad. And for that, we can take ibuprofen or Tylenol, and sometimes cold and flu. Yes? Headache. Oh, when your head hurts. Another problem you may run into if you don't feel good is a runny nose. A runny nose. When your nose, runny nose, R-U-N-N-Y, N-O-S-E, a runny nose. These pills can help a runny nose. Cold and flu helps with runny nose. Also helps if you sneeze. Do we all know a sneeze? It's a funny word. Sneeze. Sneeze. A lot of E's. S-N-E-E-Z-E. Sneeze. These are good for a sneeze. You can get cold and flu if you're sick. There's also for sneezes for allergies. If the flower bothers you, you sneeze, also allergy pills. We also cough. We cough. A cough. C-O-U-G-H. Cough. This can help with cough. This is good for cough. Very good for cough. All right? Sometimes our stomach, our tummy does not feel good. You have upset stomach. Do we know upset? Angry. U-P-S-E-T-S-T-O-M-A-C-H. Your stomach. When your stomach's upset, they make antacid. Antacid. It stops acid. Little chalky pills, and you put them in, and chew them up and swallow them. Make your tummy feel better. Very much better tummy. Also, if your ear starts to bother you or itches, you can get ear drops. Ear drops. E-A-R-D-R-O-P-S. Ear drops. With ear drops, you draw some out and just drop in the ear, right in your ear. Make your ears feel all better. If you have problems with these things, you can go before the doctor to a pharmacy. This is a weird word too. We've discussed pH. pH is pharmacy. P-H-A-R-M-A-C-Y. Pharmacy. All of these are from the pharmacy. To make you feel better if you're not feeling good. At the pharmacy is a special person who knows. They're very smart about these things. Much smarter than teacher. You can ask for this big word. Pharmacist. It's a big word. Pharmacist. P-H, right? P-H-A-R, far, M-A, ma. And our C this time sounds like an S. C-I-S-T, cyst. Pharmacist. And you tell them you need help. Just tell them you need help. You say help and you can, or or say your tummy, you don't need all the words. You can learn them, but if you need help, the pharmacist will help you. They're good people. They're always willing to help you. Right now, we're not allowed to see each other so that nobody gets sick. I can give sickness to you, or you could give sickness to me, and we can take sickness home to our family, and that would make us all sad. So we're trying not to do that now. You be careful. If you feel sick, take the right things. You can have fever, yes, a fever, hot. You can have a runny nose, a cough. You can have sneeze, or you can have upset belly, yes. Sometimes you're not breathing right, hard to breathe, cough medicine, cold and flu medicine. Both very good if you can't breathe. Now, if you don't mind, we're going to go in here and we're going to wash our hands again, just like we did before we left class. I want to show you how we wash hands one more time, okay? Come along with me. Here we go. I hope you can see here we have hot, and cold. We want very hot water. All the way under the wrist, very wet. Wet everywhere. We get lots of soap, S-O-A-P, and we want to rub all over the hands. Front, rub the back. Wash every finger really well, round and round. We want to get everything so that nothing's left. And if you'll remember, we went 20 seconds. We sang happy birthday in class. I'm not going to sing to you because I don't sing good. In very hot water, rinse everything off. Very clean. All right. I want to thank you for being patient with me. I've told you all about my dog Lemmy. I thought before we left today I would introduce you to Lemmy. I will show you my ugly dog. Come this way. He left. Hold on. I'll be right back. Oh my gosh. Here's Lemmy. Lemmy says, hi everybody. He says, stay healthy. And we hope to see you all again soon. Have a good day.